session 6, and I will be moderating this session. We are honored to have with us our distinguished session chairs. I would like to invite them on stage. The first session chair for this session is Professor Dr. Muhammad Ilyas Siddiqui. Professor Siddiqui is Dean Community Medicine and Public Health Sciences at Lumhs Jamshoro. He is Professor of Community Medicine and Public Health. Next, I would like to invite Professor Dr. Imran Sheikh. Professor Sheikh is Professor of Medicine as well as Director Quality Assurance at Lumhs Jamshoro. Thank you, professors, for gracing this session with your presence. Before we start off, I have a few instructions for the presenters and audience. Each presenter will have 7 minutes for presentation. The first reminder of time will be given at 5 minutes mark. Kindly remain within the allocated time to ensure smooth running of the proceedings. Audience members are requested to hold their questions until the question and answer period at the end of the session. We have a total of 15 papers to be presented in this session. Calling on stage the first presenter, Aisha Hina. The paper she will be delivering is titled Correlation Between Sleep Status and Menstrual Distress Among Young Females, Addressing a Knowledge Gap in Existing Literature.
Before starting the presentation, I would like to highlight that there is no question related to the subjective of the presentation. You can make a simple comment or one comment after one presentation.
Assalamu alaikum, respected chairs, co-chairs, my teachers and colleagues. I am Aisha Hina from 4th year MBBS Lumhs, and today I am honored to present our research on the correlation between sleep status and menstrual distress among young females. This study was conducted with my colleagues Abdul Kareem, Abdul Muqeed, Aisha Fatma and Ayman under the supervision of Dr. Pashmina at Lumhs. Now let's begin our presentation with the background. Menstrual distress, which includes symptoms like menstrual pain, fatigue, and mood swings that affect the daily lives of many women. At the same time, sleep is essential for health and hormonal regulation. Poor sleep makes menstrual symptoms worse, already showed by the global research. However, in Pakistan, research is scarce due to cultural stigma in our society. So the rationale of our study is to explore sleep menstrual distress link to guide and provide better strategies and improve the well-being of young women. Now let me outline our aim and objectives. So our aim was to investigate the correlation between sleep status and menstrual distress among young females in Pakistan. So for this, our objectives were to assess the sleep status of young females, to measure the extent of menstrual distress and to find out how and if these factors are connected with each other. Now I will explain the methodology of the study. So our study was a cross-sectional survey conducted through a Google form. So our sample included 173 females, all with regular menstruation. We excluded anyone with chronic sleep problems or hormonal disorders. The questionnaire included sleep index, premenstrual symptom screening, and visual analog scale. For analysis, we used SPS version 25, and descriptive statistics were applied, and chi-square test was performed to check the correlation between sleep status and menstrual distress. Now let's look at the results. So here is the first table showing the prevalence of menstrual symptoms. The most common ones were the mood swings followed by the fatigue and bloating. And the second table shows sleep disturbances. About 38% had difficulty falling asleep, and 32% had frequent nighttime awakenings. Shockingly, 98% of the participants reported using electronic devices before sleeping, which we know disrupts sleep quality. Now let's move on to the graphs. Here is the graph showing the relationship between sleep status and menstrual distress. So here you can see a upward trend here. As you can see, as the severity of menstrual distress goes up, the frequency of sleep problems also rises, showing a direct positive correlation between sleep status and menstrual distress. Now, let's move into the discussion and compare our results with the existing literature. Our findings fit very well with the international research, as Baker and Driver study shows a significant correlation, and also Lawton-Baker's bidirectional model also shows what we exactly found in our study. But here is where our study differs. In Pakistan, there is cultural stigma. Means women may have underreported their symptoms, so the problem may be even bigger than what we actually captured. So in conclusion, our key findings were we found a positive correlation between these factors, and also we found a critical contributing factor, which was the high use of screens before sleeping. And also there was low awareness and limited action we found in our study. So here are our recommendations. First, in clinical practice, doctors should integrate sleep screening into routine gynecological visits, and menstrual symptoms should be managed more proactively to improve the well-being. So in public health, we need targeted awareness campaigns which should not just highlight the link, but also teach us practical sleep strategies. As no study is perfect, so ours also has some limitations. So actually we conducted a cross-sectional study which can only show association but not causation. And because of our convenience sampling, it limits how widely the results can be applied. So for the future, we suggest longitudinal studies to establish cause and effect relationship, and the sample should be larger and diverse for wider generalization of the results. So at the end, I would like to acknowledge those who made this study possible. I'm greatly thankful to our participants, to our supervisor, Dr. Pashmina, and to our entire research team. Thank you all very much for your kind attention. Now I would be happy to take your questions.
Thank you, Aisha, for shedding light on such an important area. Next, I'd like to call upon Isra Imdad. The paper she will be presenting is Evaluation of Mean Platelet Volume and Neutrophil to Lymphocyte Ratio in Polycystic Ovary Syndrome patients with or without insulin resistance, a cross-sectional study.
Bismillahirrahmanirrahim. Assalamu alaikum and good morning. I am Isra Imdad, and today I'll be presenting a research titled as The Evaluation of Mean Platelet Volume and Neutrophil to Lymphocyte Ratio in PCOS patients with and without insulin resistance, a cross-sectional study. This study was conducted under the supervision of Dr. Arsalan Ahmed Ukeli, Assistant Professor at Physiology Department in Lumhs. And so I'll begin my presentation with a question that what if a routine blood count could reveal hidden inflammation and insulin resistance in the PCOS patients, and that can make even PCOS more severe. As we know that PCOS is the most common endocrine disorders in the woman of reproductive age. Behind every single case of PCOS, there's a young girl who is suffering from infertility, from irregular cycles, from the fear of being overweight. So the traditional inflammatory markers like cytokine, CRP, interleukins, they're very costly and they are not routinely done in our society. So we take those parameters which can be easily taken out from CBC report like mean platelet volume and neutrophil to lymphocyte ratio, and that mean platelet volume indicates the activation of platelets, and neutrophil to lymphocyte ratio, that indicates the systemic inflammation. So they are the early markers of inflammation that help us to detect inflammatory burden in the PCOS patients. So let's move towards the background of our study. PCOS affects 8 to 13% of women globally, and it is strongly associated with insulin resistance and chronic low-grade inflammation. Both of these things are not only exacerbating the symptoms of PCOS, but it can lead to metabolic dysfunction like type 2 diabetes, obesity, weight gain, and cardiovascular diseases. And the rationale of our study is to address the diagnostic gap and low resource settings. Hematological indices from complete blood count like MPV and NLR are being investigated as surrogate markers of inflammation. And however, the evidence remains inconclusive, especially among South Asian population. This study seeks to validate MPV and NLR as a potential inflammatory markers of inflammation in PCOS. So the objective of our study is, number one objective is to compare MPV and NLR in between insulin resistant and non-insulin resistant PCOS patients. And the other objective is to evaluate the correlation in between the MPV, NLR, and BMI in PCOS patients. So moving towards the methodology, our study was single-centered and it was cross-sectional and it was conducted at gynae department. And the study population was divided into two groups. Group A was PCOS with insulin resistant and Group B was PCOS with non-insulin resistant with the sample size of 128. And the other component like clinical data in which age, BMI, waist circumference, acne, hirsutism, and menstrual irregularities, family history of PCOS, family history of other metabolic disorders, lab assessment in which CBC, MPV, NLR, fasting glucose, insulin, and HOMA-IR was very important. And we use SPSS version 26 for data analysis. Moving towards the results section, as you can see that demographic characteristics of the study participants, you can see here clearly that BMI is more marked, more increased in PCOS with IR, with significant p-value, and all other variables like age, BMI, menstrual irregularities, acne, and hirsutism, and the family history is also more marked in PCOS with insulin resistance. And as you can see here in this slide, there is the comparison of inflammatory markers between PCOS patients with and without IR. Mean platelet volume and neutrophil to lymphocyte ratio both are increased in PCOS with insulin resistance with significant p-value. That was our first objective. You can see here clearly the result of our first objective, that both inflammatory markers, which can be easily taken out from CBC report, are more marked in PCOS with insulin resistance. And this is the heat map, which give us the correlation between BMI, MPV, and NLR. This is very, very important because it gave us very amazing, very alarming correlation. You can see here clearly that BMI is strongly correlated with MPV and NLR with a value of 0.96. And MPV and NLR both are also strongly correlated with one another with the value of 0.97. It means the more the BMI, the more will be the inflammatory markers, the more will be the inflammation, and the more will be the insulin resistance inside the body. So this was our second objective, and this is a strong correlation of all the three parameters with one another. So coming towards the discussion, our study confirms that both MPV and NLR were significantly elevated in insulin-resistant PCOS patients. So these findings reinforce the link between the metabolic dysfunction and low-grade inflammation in PCOS. And yeah, there are certain studies like Legro, Barber, and Yilmaz et al. Have similar findings with our study, and few Turkish studies like Bademci and Seti et al. They didn't find any significant MPV and NLR differences in between the PCOS patient. Yeah, it can be due to ethnic and genetic variation, it can be due to lifestyle or dietary changes, or it can also be due to BMI or phenotypical differences. Or yeah, it can also be due to sample size differences, because our sample size was very short and it was a single-centered cross-sectional study also. So coming towards the conclusion, I have already again and again mentioned that we have found that MPV and NLR were significantly higher in insulin-resistant PCOS patients. So our recommendation is that to integrate MPV and NLR into routine PCOS screening protocols and to promote awareness among clinicians about the inflammatory nature of PCOS and to encourage multidisciplinary management, which it must include gynecologists, endocrinologists, and nutritionists also. So coming towards the limitation, our study was single-centered and it was cross-sectional and it lacked lifestyle or dietary data. So in future research must conduct multi-center and must be longitudinal studies and must explore the threshold values of MPV and NLR that indicate the clinical significant inflammation of PCOS. And they must investigate the impact of lifestyle interventions and they must consider the expanded marker panel. Thank you. So these are the references. Thank you so much for giving me your valuable time and I'll be happy to take questions.
Thank you, Isra. Next, I would like to invite Ghania Khan. The paper she will present is titled Effects of Nighttime Phone Usage on Sleep Quality and Attention Span Among Healthcare Students, a Cross-Sectional Study.
Assalamu alaikum and good morning everyone. My name is Ghania Khan, 4th year MBBS Lumhs, and I will be sharing our study titled Effects of Nighttime Phone Usage on Sleep Quality and Attention Span Among Healthcare Students, a cross-sectional study. Nighttime phone usage has become widespread among students today. Blue light emission from phones disrupts melatonin production and disturbs the circadian rhythm, while cognitive stimulation delays sleep onset. Poor sleep is linked with impaired learning, and reduced attention can significantly affect the overall academic performance. Although this issue is recognized globally, there is still limited evidence specifically exploring its impact among healthcare students in Pakistan, which formed the basis of our study. This study was undertaken because the habit of using phones at night is not just common, it is becoming a health concern. Despite international studies highlighting its negative effects, there is a lack of local evidence specifically focusing on healthcare students in Pakistan. The objectives of this study were to assess the correlation between nighttime phone use, sleep, and attention, and to compare results across different academic programs and identify common nighttime phone usage patterns. This was a 6-month cross-sectional study, enrolling 280 students from multiple medical universities in Pakistan. Students who were using phones for more than 3 nights per week were included, while those with cognitive disorders or on any sleep medications were excluded. We assessed sleep quality using the Pittsburgh Sleep Quality Index and attention span using the Mindful Attention Awareness Scale. Statistical analysis was done via SPSS, and a p-value of less than 0.05 was considered significant. Our findings reveal a positive correlation between nighttime phone usage and PSQI scores, with a correlation coefficient of R is equal to 0.260 and P less than 0.001, meaning that greater nighttime phone usage was linked to reduced sleep quality. Heaviest users, those using phones for more than 3 hours per night, had the worst sleep indices. And for attention span, our findings revealed a negative correlation, with the correlation coefficient of R is equal to minus 0.147 and P less than 0.001, meaning that greater nighttime phone usage was linked to reduced attention span. These findings were consistent across all the departments. Our study shows that greater nighttime phone usage is linked to poor sleep quality and reduced attention span. These findings are in line with previous international studies like Sohu and others, Girl and others, and Iscoida-Konda and others. The consistency of these findings across multiple regions reinforces the global impact of this issue. Our study adds valuable data from Pakistani healthcare students, highlighting that this is a universal issue and not restricted to any single population. In conclusion, nighttime phone usage impairs sleep quality and is associated with decreased attention span. Although the effects were modest, they were statistically significant, making them important for student well-being and academic performance. In future, we recommend encouraging digital hygiene before sleep, such as limiting screen time an hour before going to bed. Institutions should also implement awareness campaigns and raise wellness programs into academic curricula. Additional strategies such as using blue light filters may also help minimize the adverse effects. Our study's cross-sectional design prevents causal inference, while self-reported data may have introduced potential recall bias. Future research should involve prospective studies with objective tools like actigraphy or EEG for more accurate measurements. Thank you. I would be happy to answer any questions.
Thank you, Isra. Thank you, Ghania, sorry. Our third chair has joined us. I would like to invite Professor Dr. Munawar Alam Ansari to join us on the stage. Professor Ansari is Dean, Basic Medical Health Sciences. Next paper will be presented by Lajina Seher. The title of the paper is Fingerprint Patterns in Relation to Gender and Blood Group Among Students at Lumhs, Jamshoro.
Good morning, respected judges and everyone. My name is Lajina Sahar and I'm a fourth-year medical student from Lumhs Jamshoro. Today, I'll be presenting our research on relationship of fingerprint patterns with blood group and gender among students at Lumhs Jamshoro. So fingerprints are something that we see daily, but in forensic medicine, they are more than ridges on the skin. They are a unique identity marker, permanent and individual to each other. So this study explores whether fingerprints carry hidden genetic clues linked with blood group and gender in our population. So coming to our background, dermatoglyphics is a study of fingerprint patterns was first introduced by Dr. Harold Cummins in 1926. Fingerprints are unique and permanent, which makes them a very reliable tool in biometric identification. Fingerprints are classified into loops, whorls, and arches. At the same time, ABO and RH blood groups act as well-established genetic markers with forensic relevance. So this study is the first study that is taking place from the region of Sindh. To our knowledge, no such data is available from Sindh. Coming to the objectives of our study, the main objectives of the study is to determine the distribution of fingerprint patterns among Lumhs students and to assess the associations between fingerprint types, gender, and blood groups. This research is very valuable in the field of forensic medicine and anthropology. For example, in situations like criminal investigation or disaster victim identification, every small clue matters. So fingerprints, when combined with other data such as dental records, DNA, or blood group, can help us narrow down the process of identifying individuals, especially in the field of forensic medicine. Now coming to the methodology, our study was designed as a cross-sectional observational study conducted over a period of 6 months. We selected a sample size of 300 medical students aged 18 to 25 years, selected using simple random sampling. We collected the data of all 10 fingers using an ink and paper method, and a magnifying glass was utilized to carefully assess the ridge pattern. We ensured ethical considerations as well. Informed consent was taken from each and every individual, and people with finger deformities, scars, or injuries were excluded from the study. We analyzed our data using SPSS version 26 and applied t-test and chi-squared test with the significance level set at p less than 0.05. Now coming to our findings, blood group O was the most common blood group found in our studies. Loop pattern was the most common fingerprint pattern across all the blood groups. And arches were the least common. When analyzing associations, there was a strong association and highly significant association found between fingerprint pattern and gender. P-value was equals to 0.009. This means that you can see in this heat map that females predominantly exhibited the loop pattern, while males had frequently reported the whorl pattern. So this suggests that fingerprint pattern may have gender-specific tendencies, with loops more common in females and whorls more common in males. On the other hand, there was no significant association found between blood groups and fingerprint patterns. P was greater than 0.05. Now, to summarize our findings, loops were the most common fingerprint pattern among all the Lumhs students, and there was a clear association found between gender and fingerprint patterns, while there was no association found between blood group and fingerprints. So, of course, our study had limitations. The sample size was limited to 300 medical students. All participants were from a single Lumhs institute, so definitely our results cannot be generalized. Most of the blood groups were self-reported, which could have definitely affected accuracy as well. We acknowledge these openly because addressing them in future research will help us get more robust results. Now, there are some key takeaways and future directions in our slides. Loop, as I summarized, were the most common pattern. Significant link was found between gender and fingerprint patterns, and no significant association was found between blood groups and fingerprints. In future directions, we need to conduct larger and multi-center studies for generalization. We need to also use of verified blood group testing techniques and expand correlations with other forensic markers. This way, dermatoglyphics can be more effectively applied in forensic identification in Pakistan as well as globally. In the end, I would like to add some references
for my research and like to express my sincere gratitude to supervisors and faculty, co-authors and classmates, study participants, and Institute Lumhs Jamshoro for providing me the platform and resources to conduct this study. Thank you so much, and I will be happy to take any questions. Thank you.
Thank you, Legina, for such an informative research. Our fifth paper will be presented by Aliza Andleev. The title is Prevalence of Polycystic Ovary Syndrome and its Association with Contemporary Lifestyle Factors, a cross-sectional study.
Assalamu alaikum. Good morning, everyone. My name is Aliza Andleev. I am a third-year MBBS student from Liaquat University of Medical and Health Sciences, Jamshoro. And today, I will be presenting our research on prevalence of the polycystic ovary syndrome and its association with contemporary lifestyle factors, a cross-sectional study. Moving forward, with our table of content, we have background, objective, methodology, result, discussion, conclusion, and limitations and future directions. As we all know that polycystic ovary syndrome, as PCOS, is a hormonal disorder which affects 8 to 13% of the reproductive age women globally. It is not just about the ovarian cyst, but it is characterized by the hormonal imbalance, metabolic dysfunction, and serious mental health effect. And here's the key, that modern lifestyle factors such as physical inactivity, poor dietary habits, chronic stress, and disturbed sleep can actually make the PCOS worse. Our objective was to compare the diagnosed and the undiagnosed PCOS patient and to examine that how the lifestyle factors such as sleep quality and diet quality affect the severity of the PCOS. And we also focused on the mental health indicators since the depression, anxiety are often under-recognized in these patients. The methodology was, we conducted a cross-sectional observational study on 100 adult women aged between 18 to 40 years from Hyderabad. We uses validated questionnaires. For example, for sleep quality, we use PSQI. DAS-21 was used for depression, anxiety, and stress, and DQQ for the diet quality. And we also conducted the medical history. For analysis, all the data was analyzed using the SPSS 23. We also ensured the quality of our results using the Cronbach's alpha test, descriptive statistics, Shapiro-Wilk test, non-parametric methods with the p-value of 0.05 were considered significant. Moving forward with our results, which were striking, is that the depression scores in diagnosed PCOS patients were significantly high with the p-value of 0.01. And same goes with the anxiety level with the p-value of 0.006. And the stress scores were also significantly higher in the diagnosed patient with the p-value of 0.001. As you can also see that the orange bars are consistently higher in the three subgroups. Next, the lifestyle factors is that the diagnosed PCOS patient showed significantly poor sleep quality with the p-value of 0.007 and poor diet quality with a p-value of 0.41 compared to the undiagnosed group. As you can see, the orange bar are significantly lower, which shows the worse sleep quality and diet quality. Moving toward our discussion, our findings align with the recent literature showing bidirectional relationship between PCOS and mental health. As Kai 2021 stated in their study that sleep disturbances in PCOS may be mediated by hormonal imbalances, metabolic dysfunction. Suzuki 2021 also stated in their study that poor diet quality in PCOS patient correlates with increased inflammation and insulin resistance. Lifestyle interventions targeting these factors shows promise for comprehensive PCOS management as stated by Muhammad 2025. Moving toward our conclusion, our study concludes that PCOS contributes to the elevated levels of depression, anxiety, stress, and poor qualities of sleep and diet as an extreme lifestyle and psychological impact. This connection between lifestyle factors and PCOS provides valuable insight for prevention, early detection, and targeted interventions. We recommend the healthcare providers should incorporate lifestyle assessment and management in comprehensive PCOS care. Also, our study has limitations, which is it has a cross-sectional design which limits the causal inference. As the sample size is small, which is 100, it may limit the generalizability. Self-reported data may introduce recall bias, and there is a limited geographical scope, which is only Hyderabad. For future directions, we recommend the future researchers to do longitudinal studies to establish temporal relationships, larger multi-center trials with diverse population, objective measures of sleep and dietary patterns, intervention studies targeting lifestyle modifications. I would like to acknowledge Professor Dr. Ikramuddin Ujjan, Vice Chancellor of the LUMS Jamshoro for institutional support, our supervisors Dr. Nusrat Nisar, Dr. Zulfikar and Dr. Shafaq for methodological assistant, and all my co-authors for their support. At the end, I would conclude my presentation with that behind every statistic, there is a woman struggling silently. Our study reminds us that with early detection, lifestyle changes and support, we cannot just give her the treatment, but a brighter future and hope. Thank you so much. I will be later taking your questions.
Thank you, Eliza. Next, I would like to invite Ikra Pawar on stage to present her paper titled How to Connect Abstract Art with Electromagnetic Impulses of a Human in Order to Treat Mentally Ill Patients.
Bismillahirrahmanirrahim, starting with the name of Allah, who is omnipotent, omnipresent. Assalamu alaikum, ladies and gentlemen. My name is Ikra Pawar, and I am fourth year student at LUMS Jamshoro. It is an honor to be here today to present my research. Title of study: How to Connect Abstract Art with the Electromagnetic Impulses of Brain in Order to Treat Mentally Ill Patients. Why we need this connection? Well, to experience normality, first we have to understand abnormality. Background of study: abstract as form of art provides us escape from realistic representation. It gave new ways to convey ideas and emotions. Connection between art and electromagnetic impulses of brain is proven through electroencephalogram studies with the recordings of cortical and subcortical stimuli, addressing various conditions including depression, anxiety, schizophrenia, bipolar, OCD, and trauma disorders. Objective: to explore the importance of abstract art and its connection with the electric and magnetic impulses of brain. To analyze and record patterns of normal and abnormal brain waves. In what way and how the patient follow in their art to showcase their unconscious conflicts. Methodology: qualitative research based on grounded theory, theory development method, first constant comparative method, second theoretical saturation. Data collection method was experimental. Number of participants 6. Patients were recruited before art therapy EEG recording and after therapy EEG recording. जो आप मेरी पुष्ट पर ये पिक्चर्स देख रहे हैं, ये हमने ऑन द ग्राउंड पिक्चर्स को क्लिक किया है. These are original pictures from ground. Observation, setting, EEG laboratory. Duration was 2 hours. Document analysis is very important. Based on their diagnosis, we observe and record their abnormal EEG waves. Then we save first recording and apply therapy, give them command to draw patterns on papers. After they finish, we record their second recording to see changes in their waves. They were relevant because it is evidence and comparison between normal and abnormal EEG recordings before and after therapy. Results are also interesting. My results in the research is narrative form. These are visuals, original visuals drawn by our patients. Case 1, Alam Shah, suffering from symptoms of bipolar. Before therapy, EEG waves. Gamma and increased theta and delta waves. After therapy, decreased theta activity seen. Case 2, Kainat, suffering from depression. Before therapy, theta and alpha waves are slowed. After therapy, alpha with normal activity is seen. Case 3, interesting. एहसान अली, जिसकी उम्र थी 20 साल, उसकी इंटेलिजेंस थी 10 साल के बच्चे तक. Suffering from fits, has intelligence of 10 years old child. Before therapy, EEG wave theta diffuse in awake state, indicated abnormality. Beta disturb frequency 8 to 9 Hz. After therapy, beta frequency leads to 10 to 16 Hz, which is astonishing results. Alpha wave seen. Case for Bisma, before therapy, EEG wave sharp and slow wave discharges more on the left hemisphere. After therapy, no EEG waves appear. Bisma is 12 years. Case 5, Arisha, suffering from schizophrenia, EEG before increased delta and theta waves, after therapy alpha activity seen. Case 6, Raja, suffering from trauma of her dead mother. Before therapy, EEG waves, beta increase, alpha slowed. After therapy, theta waves seen, more discharge in the right side of brain. Discussions. The normalization of EEG wave pattern characterized by increased alpha activity suggests that art therapy has positive impact on brain function. This is consistent with previous researches that shown that art therapy can improve cognitive function and reduce symptoms. Conclusion. The research contributes to our understanding of complex relationship between electromagnetic impulses of brain in patients indulged in different mental illnesses and trauma. The results of this study can help build a practice method in new diseases. Through this, one can prepare himself or herself for pre-trauma and post-trauma. Key takeaway messages: exploring deep traumas are essential for managing impact of syndrome. Increasing mental health issue has severe destructive effects on our biological evolution. Recommendation. So our society is too lazy to handle fears. So my first recommendation is society should accept these lessons and try to handle fear regarding mental health issues. Further research should focus on more conditions and innovative solutions in order to understand connection between brain waves and therapy. Limitations. While the study findings are promising, firstly, the sample size was small. Secondly, the study did not control for other factors such as medication use. Finally, the study only examined the effects of abstract art therapy on EEG wave patterns and symptoms. Further research is needed to fully understand the core connection between these two events. Thank you. I would like to thank, special thanks to Neuromedicine Department, LUMS, and my co-authors. Thank you.
Thank you, Ikra. Next in line, we have Mohammed Bachal. He will be presenting on topic Practice and Barriers of Interdental Cleaning amongst Medical Students at LUMS Jamshoro.
Assalamu alaikum and good morning everyone. My name is Mohammed Bachal and today I am here to present our research on practice and barriers of interdental cleaning among medical students at LUMS Jamshoro. To begin, let's discuss the background of our study. Interdental cleaning is a vital complement to toothbrushing as it effectively removes plaque and debris from areas brushes cannot reach. Dental flossing is in particular plays a key role in preventing gingivitis and periodontal disease. For medical students, understanding and practicing effective oral hygiene is crucial, as they will eventually educate and influence patients about preventive health behaviors. This highlights the importance of our research. Our study had a clear objective to evaluate the knowledge, attitudes, and practices related to dental flossing among medical students at Jamshoro and identify perceived barriers to its regular use. Far more specifically, we aim to assess the awareness of medical students toward the dental flossing as part of routine of oral hygiene, and to identify the barriers that prevent them from practicing regular dental flossing. To achieve our objectives, we conducted a cross-sectional observational study at Lumhs Jamshoro. Our study population consisted of medical students, both MBBS and BDS students. We calculated a sample size of 327 students using OpenAPI with a 95% confidence level. We use our non-probability consecutive sampling technique for data collection. The data collected using a self-designed questionnaire and address demographics, awareness, barriers, and flossing frequency. For data analysis, we use SPSS version 20, employing chi-square test where p-value of less than 0.05 was considered significant. Ethical considerations included obtaining IRB approval and digital informed consent with strict confidentiality maintained throughout the study. Now let's move to our results. We had 236 respondents with mean age of 20.3 years. The student distribution showed that 44.1% were BDS students and 55.9% were non-BDS students. A significant finding was that 59.8% of the students had received formal instruction on dental flossing. However, despite this, only 41.9% were aware of the recommended flossing frequency. We also found significant association between the year of study and both awareness and formal instruction received with a p-value of 0.00. Our findings reveals a significant knowledge practice gap despite 59.8% of students receiving formal instruction. Only 41.9% students were aware of the recommended flossing frequency, indicating a clear disconnect between education and retention. When it came to barriers to regular flossing, time constraints emerged as the primary barrier, reported as 35.6% students. The significant association between the year of study and awareness suggests that the curriculum exposure does improve knowledge. This has important implications for future healthcare providers, as their personal oral hygiene practices may directly influence their effectiveness in educating patients about preventive health behaviors. In conclusion, our study underscores a significant gap between awareness and practice of dental flossing among medical students. Among future healthcare providers, despite receiving formal instruction, many medical students lack awareness of recommended flossing frequency. Furthermore, time constraint, cost, and perceived difficulty are significant barriers to regular dental flossing. These findings highlight the need for improved oral health education within the medical curricula. Based on our findings, this study aims to promote better oral health education in medical curricula and encourage the integration of effective interdental cleaning habits among future healthcare professionals. We recommend integrating dedicated oral hygiene modules within the medical and dental curricula, with a specific focus on interdental cleaning techniques Additionally, implementing practical demonstrations and hands-on workshops would address the perceived difficulty in flossing technique. Of course, our study has some limitations. It was a single institution study, which may limit its generalizability to other medical schools. Also, we experienced a sample size reduction from 327 students to 236 respondents. For future directions, we recommend conducting multi-center studies across different medical institutions to improve generalizability and further validate our findings. We would like to thank the faculty and students of Liaquat University of Medical and Health Sciences for their participation and support in this research. On this slide, you can see these key references. Thank you for your attention.
Hello. Mic on. We need one comment after the presentation. Any comment on the presentation of Mohammed Bachal? So before moving to the another presentation, we need one comment from the audiences. So I would like to comment on the presentation of Mohammed Bachal. We listened the presentation since morning. This is the only presentation which has the sampling technique. Most of the presentation we listened, they didn't mention the sampling technique. Any comment from Professor Ansari Sahab or Professor Siddiqui Sahab?
Thank you, sir. It was a good presentation by Bachal, and you need to improve your presentation skills. And also, you have done one good thing that you have mentioned that you have reduced the sample size because of the limitation. So everyone should properly address the limitations. Thank you.
The floor is open for any questions.
Actually, the questions must be from the audience side, the student side. The students must take an active part in the question and answer session. Because the whole event is for the students. Please, come on. No questions means aap soye hue ho. You are sleeping. So are you sleeping? Okay.
So many good presentation you have listened since morning. These were the clinical studies, and so many questions you just brought in your mind. So you have listened 2 or 3 presentations of the PCOS. It's a very common problem with so many shapes of a single disease. Fingerprinting, it's one of the innovative type of the study that is correlated with the blood groups. So many studies you have listened. Any questions from audiences?
Anyone? Would you like to ask any questions, please? Thank you, chairs. We will now be moving forward with the next presentation. I would like to call upon Mohammad Hanzala Yusufani. He will be presenting on the topic, Impact of AI Usage on Academic Performance of Medical Students of LUMHs, Jamshoro.
Assalamu alaikum and a very good morning to all of you. Thank you all for being present here today. My name is Mohammad Hanzala Yusufani. I'm a third-year MBBS student here at LUMHs Jamshoro, and I'm very pleased to be presenting my paper in front of such a dynamic group of individuals. The paper I'm going to be presenting before you today is titled Impact of AI Usage on the Academic Performance of Medical Students of LUMS Jamshoro. Here are my co-authors on screen. Special thanks to my supervisor, Dr. Zubair Ahmed Yusufani. So let's start, shall we? What exactly is AI, and why has it taken the modern world by such a storm? Basically, in simple words and lines, AI means that computers can think and learn like humans. When you hear that at first, you might get scared and it might sound as a scary thought. But AI, because of its undeniable qualities, has proved its significance in almost every occupational sector in the world, including the healthcare sector. More specifically, what we're going to talk about today is the academic aspect of the healthcare sector. Me and my peer noticed here at LUMS Jamshoro that there was a gap, the gap being that the impact of AI upon the students' day-to-day lives and the academic impact was not systematically studied or even evaluated. So what me and my co-authors did was conduct a study which evaluated the impact of AI and how it impacted the academic performances of the students at LUMS Jamshoro. Our study provided insights to both benefits and challenges of AI, and more specifically how students adopted AI and how it had a measurable impact on their examination outcomes. Moving on to the methodology of the study, my study was of a cross-sectional design. It was conducted at LUMS with a study period of 2 months. The target population were MBBS students enrolled from first to final year at LUMS Jamshoro, and the sample size was calculated using Open EPI, and the final sample size came out to be 285 participants. We used a stratified random sampling as our sampling technique to ensure that the representation from all 5 academic years is nearly uniform, and it was. We administered a structured self-interest questionnaire, which was provided through online Google Forms and in printed formats. The participation was absolutely voluntary, and informed consent was obtained. Our questionnaire included closed-ended Likert scale and open-ended items, and it was pilot tested before the main survey for validation. Our study exclusively included MBBS students enrolled at LUMS from first to final year, and it excluded any graduated students or students other than from LUMS to Jamshoro. Let's move on to my favorite part, which is, of course, the results. From the demographic section of our questionnaire, we found out that the participation was 43% from female, and 57% of the participation was from male. And because of our sampling technique, the participation from all the academic years was uniform. When we evaluated the AI usage patterns of the students, we found out that 83% of the students reported using AI, from which is no surprise to any of us, ChatGPT emerged as the most commonly used AI tool, reported by 74% of the students. Usage of AI flashcard applications like Anki was reported by 52% of the students. Grammarly and other AI writing tools were reported by 40% of students. Lastly, MedGPT was reported by 33% of students. In terms of frequency, 35% of students reported using AI on a daily basis, 30% of students reported using AI 2 to 3 weeks, 11% of students reported using AI on a weekly basis, and a very minuscule 6% reported using AI on a very rare basis. Our questionnaire included a Likert scale, as I mentioned. Our Likert scale was graded from 1 to 5, 1 being strongly disagree and 5 being strongly agree. So for every question, if it's a positive statement, higher score meant a positive impact for AI, and a higher score for a negative impact meant a negative score for AI. So we provided students with some statements you can see here in the table. Some interesting ones are, most students felt that AI improved their performance, which yielded a mean score of 3.9. The strongest benefit we found out was that AI could help students study efficiently in less time, which yielded a whopping mean score of 4.1, along with reduced study hours, which yielded a whopping score of 3.7. However, as we all know, the grass is not always as green as it seems. What do I mean by that? I mean that AI, although comes with benefits, definitely comes with challenges. Some of the drawbacks included reduced teacher interaction, it yielded a mean score of 3.2, lower class attendance, which yielded a mean score of 3.3, and the most important and concerning one, growing dependency on AI tools, which yielded a mean score of 3.8. When we did a comparison between how frequency of AI usage compared to the examination scores of the students, we found out that the students who used AI daily achieved the highest score, and the trend went downwards as we could see. Moving on to the last part of our questionnaire, we did a comparison between AI users and non-AI users and how their examination outcomes and scores related. We could see AI users yielded a mean score of 76.3, while non-AI users got a score of 70.2, which is a significant difference, and which further proves testimony that AI can be a very significant and positive tool in the academic aspect. Our p-value of less than 0.05 reinforces the strength of academic performance and its relationship with AI usage. So, we talked about all the findings, but what do the findings mean? Let's discuss that. From our findings, we can decipher that frequent users of AI demonstrated significantly better academic performance and reported greater study efficiency in less study hours, which confirms global findings that AI enhances comprehension, feedback, and exam preparation. However, concerns were noted regarding dependency and reduced interaction with faculty, which echo warnings in existing literature about over-reliance of AI potentially undermining critical thinking and collaborative learning. We conclude with the same. We conclude that AI can be a very beneficial tool, and it has proven to be a beneficial tool, but it has definitely come with its challenges. But what we could take away from our study is that AI needs to be used, definitely needs to be used in an academic aspect, but it needs to be used in a balanced integration. What do I mean by balanced integration? I mean by balanced integration is that AI should be used in academics with the faculty guidance. It should be trained among students so students can get the full potential of AI. It should be incorporated, but traditional methods should not be abandoned. So we can make sure we could have a mix of AI with traditional methods. From this, we could make sure that students don't get overly reliant on AI, but students don't ignore AI, because we know AI is such a significant tool and ignoring it would just be a stupidity. Every study came with its limitations. Mine did as well. Firstly, the study population only consisted of students at Lumhs Jamshoro. The sample size was not small. Our study relied on self-reported data, which could induce recall or response bias. And lastly, the cross-sectional design of the study prevents assessment of long-term effects of AI usage on academic performance. Thank you very much. Any questions?
Any comment from the audiences? Hanzala, just to stay here, I want to ask a question or comment. What do you think the AI improves which domain of the student? The theory, the practical skill, or their thinking? The AI improves the which domain of the clinics or which domain of the student learning or education? It could be a theory or clinical skill or the abstract or the clinical reasoning.
Sir, AI, first of all, as mentioned in our study, helps students study more efficiently. Let's see what that means. AI is such a broad term, but it is so significant that the questions you just asked me, clinicals or theory or reasoning, AI has helped with all of this. You can take testimony.
I'm asking what you have done in your study.
Sir, we gave student statements. We asked them if AI include their critical thinking, efficiency, and study hours. Those were the basic sections of our study where we asked students if exam performance were, our main criteria was exam performance. Exam performance means theory. Our main criteria was dependent on theory and exam performance. It also relied on study hours, critical thinking, and these were the sections of our study.
So do you think so AI improves all the domains of the learning?
Sir, I think yes, I truly strongly believe that AI can improve all the domains of the study. Okay. There is nothing AI can't do.
Domain of the learning. Thank you.
Yes.
Audience, would you like to ask any questions?
Yes,
sir.
Hanzala, I am Dr. Salman, Dean Faculty of Dentistry, Isra University. Very nicely presented your concept. I have just a question because the impact was self-perceived impact, and impact is a very broad and deeper concept. So what do you recommend in order to, in order to conclude the more substantial result of your research? Do you recommend any future research?
Sir, I recommend future researches to have a longitudinal study so we can perceive long-term effects of AI, and we could see what AI has done long-term. The thing you're talking about, that it was self-reported data, what we could do is we could also bring in some students, bring AI users versus non-AI users, bring frequent AI users versus less frequent AI users, and we could test them. We could test them on clinical learning, we could test them on critical thinking, we could test them on many students. That way we could remove the self-reported bias. We could remove the self-reported bias by that, and future studies, if they were longitudinal, we could also remove the cross-sectional study limitation by that as well. Thank you so much, sir.
Okay, Hansila, there is a question regarding, there might be a difference between your opinion and my opinion because of a generation gap, you see?
Definitely.
I'm an old man.
Yes, sir.
But what I believe that this, all the artificial intelligence tools, they definitely interferes with the critical thinking of the human being. Do you believe it? Yes or no?
Yes, sir. It was clearly mentioned as well in my
Yes.
study that
If any tool is getting the critical thinking skills of anybody, it means you will be zero. जब आपके सोचने समझने की सलाहियत ही चली जाएगी, फॉर एग्जाम्पल, इट्स अ वेरी डेली लाइफ एग्जाम्पल, पहले जो है वो सुबह सुबह मासी आती थी, मुझसे पूछती थी साईं सुबह छा पचाया नाश्ते में, तो आई थिंक फॉर अ फ्यू मिनट्स कि बाबा अंडो ठाहे, थोड़ा सा आलू तरे छॾ, हिकिड़ो पराठो ठाहे छॾ, ऐं मूंखे चांहि ॾे. Now what I do, that I just open the chat GPT and I raise the question, kindly give the child out of my breakfast. And within no time, you will get the full breakfast diet chart. अच्छा, मज़े की बात है, अगर रात को आप उसको कहेंगे कि सुबह को मैंने ये डाइट ली है, दोपहर को ये लिए, अब मैं क्या करूं रात को, तो वो आपको वो भी बना के देगा. So this is all. We are, in the coming years, we will definitely become a paralyzed people. We just depend upon this artificial intelligence. Like now, in our days, we are not familiar with the Facebook, and now we have the addiction of this, you see, the Androids. So what could you comment on this drawback of the artificial intelligence?
Sir, I completely agree with your statement. And as embarrassing it is to admit it, I am also guilty of this. Sometimes शाम को कभी थका हुआ होता हूँ तो AI से पूछना शुरू हो जाता हूँ कि जिम जाऊँ या ना जाऊँ, और जिम क्यों ना जाऊँ, और जिम जाने की वजह बताओ, और जिम ना जाने की वजह बताओ, फिर डिसीजन बनाता हूँ अपना. So I am guilty of this as well. But as mentioned in my study that I use the word that we should use AI in a balanced integration. And by balanced integration, I said that we should use AI with the faculty guidance, like you people guiding the students, training the students on how to use AI, which could help them not get overly reliant on AI. मतलब आप उनको सिखाएं कि AI बहुत काम की चीज़ है, पर अगर हम हर चीज़ AI पे चलना शुरू कर जाएंगे, फिर हमारी critical thinking ही चली जाएगी, हमारी reasoning चली जाएगी, हमारी ability to solve चली जाएगी. तो we should use AI. 100%. I would not say कि हम AI को use ना करें. My opinion would be कि we should use AI, but limit में, integration से और awareness के साथ.
That's good. That's very good.
Simple,
may I comment, sir?
Simple
Sir,
message is that.
Sir, may I comment?
Yes.
Sir, there should be a combination of the self-study and AI usage. मैं थोड़ा अपनी ज़बान, जैसे बचपन में हम कहते हैं कि टेबल्स याद होनी चाहिए. You should know the tables, यानी जो एक होती है ना मैथ्स की टेबल्स, लेकिन will also know the usage of the calculator. अगर सिंपली हम कहेंगे कि भाई कैलकुलेटर का इस्तेमाल नहीं करना और आपको टेबल्स आनी चाहिए, तभी भी मैं कहता हूँ कि ये ठीक नहीं है. और अगर ये पार्ट हम ले लें कि भाई हमें कैलकुलेटर यूज़ करना चाहिए और टेबल्स नहीं आनी चाहिए, तो ये भी ठीक नहीं है. तो कॉम्बिनेशंस ऑफ द टेबल्स यानी क्रिटिकल थिंकिंग एंड कॉम्बिनेशंस ऑफ द इलेक्ट्रॉनिक डिवाइसेस AI, these will be beneficial for all the students. Thank you.
Very much right. Or I just quote an incident now, and one of the very recent report that one of the supercomputer competed to a chess master about 3 weeks back in the Greece. And surprisingly, that supercomputer defeated so many people previously, about 2 or 3 chess masters. But now, recently, the man defeated the machine. So remember that the man is always superior to machine. Thank you.
Thank you, Hanzala, for such a stimulating discussion. Thank you, audience. Moving forward, I would now invite Ikash Jairaj to present his paper, Role of Forensic Medicine Education in Enhancing Investigating Skills in MBBS Students.
Hello, Assalamu alaikum everyone. I am Akash Jiwaj, a fourth year MBBS student at LUMS, and today I am here presenting my research topic, that is role of forensic medicine education in enhancing investigating skills in MBBS student. I have done this research under the supervision of my mentor, Dr. Aisha Khalid, and coming to the background, forensic medicine, as you all know, it is like essentially used domain of medicine which connects the medicine with the law, and it is used among law administrators, and it helps law administrator to from like investigations from crime scene till the courtroom proceedings. And also, currently, forensic medicine is being used in public health as preventing injuries and fatalities by doing epidemiological research and policy, and then developing policies according to them. Rational. So, students often underestimate forensic medicine and they overlook it. Also, there's a lack of interest of students in their forensic subject, and they don't have awareness how the impactful and practical this subject is in their clinical and like clinical practice and society use. So medical students and professional like normally and most frequently assess the cases, medical legal cases in their rotations, and where they are like unable or sometimes inefficiently use their knowledge, and like their training is not is still insufficient to assess those cases. And here the main purpose of the study was to identify the skill gaps of the students and the medical profession and implement the intervention where we can enhance these and improve these for the future medical legal cases. And also in Pakistan, there's very limited research how forensic medicine influence and impact the student investigative skills. So the objective of the study was to assess the role of forensic medicine in enhancing investigative skills among the MBBS student, and how we can do this is by comparing the investigative skills of MBBS student before and after the intervention of forensic medicine. So the methodology, we did a cross-sectional mixed study among the MBBS student of different medical universities of Sindh, and our sample selection was third year to fifth year, as they are the students who are currently studying forensic medicine or have been studying forensic medicine. And for the data collection, we use like structure questionnaire on Google Forms, and we use Likert scale to assess the knowledge before and after the exposure of forensic medicine. And the data analysis was done through paired self-assessment of competency by the student, and it was like self-assessment. So, and the gains were, the result was actually analyzed through the Wilcoxon sign rank test, as the data was non-parametric and ordinal. So we have to calculate the magnitude of the enhancement before and after the intervention. And the ethical approval was gained by the, was obtained by the Ethical Research Committee LUMS. So here are the results. Here are the results of this study, and we have the participant size of 320, and we have assessed their knowledge before and after in 14 different forensic medicine domains, and the response was 100%. The average score gain was 1.5, and the p-value was under 0.05, which shows significant improvement after studying forensic medicine. And here you can see the bar chart, which shows that the larger improvement were in the injury type, differentiating antemortem and postmortem wounds, and understanding postmortem changes like liver mortis, rigor mortis, and also there were the notable gains across all the domains of the forensic medicine. So discussion. There were few previous studies which support my study in results and show how clinical forensic changes approaches of doctors in the like their clinical rotation in medical legal cases, and also how forensic medicine has transformed modern investigation skills in MBBS. However, they don't. These studies don't tell how degree of significance in each domain of the forensic medicine and assessment of student as a feedback of the forensic medicine. And also, let me conclude that forensic medicine education has been shown to strengthen students' analytical, observational, and investigative skills as student and physician routinely encounters requiring forensics expertise. This discipline provides essential legal, ethical, and diagnostic competencies for uncovering truth in clinical practices and judicial proceeding, and preparing them to act as unbiased medical experts. Recommendations. So we also actually had a question from the students in this structured questionnaire that do they think that clinical forensic medicine was useful in their clinical rotation, and most of them were like have a positive response. And then we again questioned them about have they experienced the medical legal cases there during their rotation, but this response was not up to expectancies. So as a result shows the gain, yet exposure to the student was not up to the expectancy. So I recommend institute to increase hand-on training, mock exercises, and medical legal stimulation to reinforce theoretical knowledge and applied skills, involve legal professional and forensic experts to teaching, and to give student practical and real-world insight. The limitation, yeah. So my study limitations was, as it was a self-assessment, so it was student may overestimate or underestimate sometimes themselves, and there is also social desirability bias that student might think that to look in a society they think to be robust and more cool, so they answer them like very biasly, and does not measure actual performance, as it was a self-assessment and it was subjective test. So in future, I like future implementation to this study would be to have a objective test and to have a more diverse sample size. Thank you, and we welcome your queries, please.
Thank you, Ikash. I do agree that forensic is usually overlooked, but it is one of the important subjects. The floor is open for questions. Does anyone have any questions, please? Chairs, would you like to give some remarks, please?
It was good presentation, and you should elaborate your results in more scientific way and with more clarity. Okay.
Thank you.
Ikash, I would like to ask a question.
Yes, sir.
What you have seen the difference in the third year and the final year student level to understanding the forensic medicine? The people are the student who have completed, and the student who are in the process of learning the forensic medicine.
Sir, as we compare third year, fourth year, and final year, as third year are learning it actively right now, because that's the main subject they are studying in third year. So they had like more enhancement, like before and after enhancement, as compared to the final year. Whereas final year had like more experience of medical legal cases, as they are like more frequent student going to the wards, but their enhancement level was not as much as we can compare it from the third year students.
So what is your single recommendation? Would you like to continue this forensic medicine in the fourth year and the final year also?
Sir, I can conclude that forensic medical exposure should be in like from third year to fourth year to fifth year, as this subject is very much essential in our society, because we all know that this subject actually helps you to interpret the result in courtroom proceedings, because a single forensic medicine single doctor is also expert witness. So their single witness can like differentiate between the true criminal and if anyone is like
Thank you
being
so
false.
much. Thank you.
Welcome.
It's a very nice presentation and a very good topic. You see the modern integrated type of teaching. So I think it helps more to understand the subjects. And forensic medicine is really a very essential subject for all the medical doctors because everybody should know the forensic medicine because it's a very specialized type of subject and it's a very important subject, no doubt. What I recommend, it should start from very basic, from the first year up to the final year, so that everybody should be very much skilled on this subject. Thank you, beta. Thank you very much.
A question or the beta? Can I ask question? Yes. Okay. यस जैसे मंसारी साहब ने कहा ना टॉपिक बहुत अच्छा था आपका बस एक क्वेश्चन है मेरा बेटा कि एक ऑब्जर्वेशन थी हमारी कि आपका जो सैम्पल था उसमें ऑलमोस्ट 80% ऑफ द रिस्पॉन्डर्स वर फ्रॉम लम्स तो एक ऐसा लग रहा था कि अनइंटेंशनल सिलेक्शन बायस आ रहा है इसमें ना कि 80% ऑफ द रिस्पॉन्डर्स फ्रॉम लम्स हो सकता है लम्स में बहुत अच्छा पढ़ाया जाता हो बाकी इंस्टीट्यूट्स में ना होता हो कि तो क्या इस ऑब्जर्वेशन को आप डू यू एग्री विद दिस?
Sir, I agree as a sample size, but as it was 320, but 5-10% or more than that, like 10% was basically from BMC and Dow, and other 10% was all over like Sin, Chantka, PUMS, GIMS. So I guess like there can be biasing, but if we could have like increased the sample size, I would think that the result would be the same.
Okay, if you would have taken the equal sample size from all institutes, the probably result would have been different. एक सिर्फ recommendation है आपको कि जैसे अंसारी साहब ने कहा ना कि अगर आप इसकी एक longitudinal study यानी कि थर्ड ईयर से लेकर फोर्थ ईयर और फाइनल ईयर तक उसके बाद फिर आप इसको ऑब्जर्व करें कि उनके जो इन्वेस्टिगेशन स्किल जो थर्ड ईयर में जिस वक्त व्हेन दे आर एक्सपोज टू फोरेंसिक क्या वो सस्टेन रहते हैं व्हेन दे गो बाय द टाइम दे ग्रेजुएट सो दैट वुड बी एन इंटरेस्टिंग स्टडी जस्ट अ रिकमेंडेशन.
Actually I have did that. It isn't sustained, like they are actively learning in third year, so they like have the very good in investigating skills, but by the time because they aren't practicing it in their like rotations, so obviously they have like faded away. Yeah.
Okay, thank you so much.
Thank you, sir.
Thank you, Ikash. The next presentation will be delivered by Immer John on the topic well-being and burnout among preclinical students in Lumhs, Jamshoro.
Hello. Assalamualaikum. My name is Immer John from first year BDS batch 2025, and the title of my study is Well-being and Burnout among Preclinical Students in Lumhs, Jamshoro. This study was conducted by me along with my co-authors Mohammad Asad, Hamza, Nazar, Jamal. So the question arises, what is burnout? So dear colleagues, burnout is characterized by emotional fatigue, depersonalization, and a scarce sense of individual achievement due to stressful work conditions. Burnout and mental sickness are more predominant in dental students compared to the common population due to excessive intellectual and communal stressors. All these are ultimately having a negative effect on the students' academic execution, physical health, and personal well-being. The factors that kept appearing in our research were that due to the distance from home and friends and the amount of coursework and the workload, students were having a difficult time adjusting to the environment. Therefore, identifying and addressing the causes of burnout and diminished well-being of dental students in early stages is of extreme importance for their health, success, and for the patient's safety. The objective of the present study were to assess the extent of well-being and burnout and to evaluate the predictors contributing to the emergence of burnout in the first and second year preclinical dental students. ethical approval was obtained from research ethics community Lumhs Jamshoro. This study was set in Lumhs Jamshoro and all preclinical students from first and second year were included. The study duration was of 2 months and the sample size was 200, from which a 60% response rate was obtained. Non-probability consecutive sampling technique was used. Data was collected by self-administrated and questionnaires generated using Google Forms and was later analyzed using SPSS updated version. Upon analysis, 51.4% of the responses were submitted by male students, whereas 48.6% were submitted by female students. The age of the participants was in the range of 19 to 22 years. Out of these participants, 88.6% belonged to middle class and 71.4% were using hostel accommodations. Well-being index was measured by using Likert scale, and the responses generated were that overall well-being score was 45.7%, which indicates poor well-being among dental students of preclinical years. In this study, 67.7% students responded with suffering from curriculum overload, whereas 64.8% were suffering from depersonalization. In present study, the prevalence of burnout among preclinical dental students was found to be very high, 54.3%, out of which 31.4% were having high levels of burnout and 22.9% were having burnouts in the moderate range. 20% of students were aware that they were suffering from some degrees of burnouts. These findings were similar to a study conducted by Humphreys 2002 and Affan 2022. It can be concluded that there is high prevalence of burnout among dental students and should be taken seriously. A more extensive study should be conducted in this field. The limitation was that because the study was conducted on preclinical dental students of a single institution, hence the result cannot be generalized. Thank you.
Thank you, Immer. The podium is open for questions now.
Imar, I just to you presented very good, but it is very essential that the PPT or the PowerPoint should be start with your presentation. So all the audiences would have all attention towards to you. So do you summarize your study in 1 or 2 sentences?
Can you repeat the question?
Can you summarize your study?
Summarize. So basically, due to the curriculum overload that students were facing, there was a high level of burnout in the preclinical students.
So what do you suggest? What is your recommendation?
My recommendation is to
just to use the mic because we are barely listening to you.
My recommendation would be spending more time exercising so you can have a fresher mind, and to spend more time with your friends and family while also paying attention to your academic sessions.
Thank you.
Okay, there's another, you see, this is not a question, it's just a clarification. You have split your data in a gender, you see the male and female. So I couldn't get actually the proper message. Which gender, male or female, they are more affected by the burnout. Could you have any data?
No data was submitted by that.
Okay, thank you.
Moving forward, now I would like to call upon Hafsa Abdul Wahid with her research titled Incidence of Helicobacter pylori Infection and its Association with Dietary Habits, a Cross-Sectional Study.
Okay.
And then you either do this,
Okay.
or you can use this.
This and this.
Yeah.
Okay. Assalamu alaikum everyone. I am Dr. Hafsa Abdul Wahid from 4th year MBBS from Sulaiman Roshan Medical College, Tando Adam. Today the topic of my presentation is incidence of Helicobacter pylori, an infection and its association with dietary habits, along with my partner Dr. Mohammad Siddiq Chauhan from 4th year MBBS Sulaiman Roshan Medical College, Tando Adam. Introduction. Helicobacter pylori is a common bacterial infection linked to gastrointestinal disorder. Its transmission is influenced by dietary habits and hygiene practices. This study examined the association between dietary patterns, hygiene, practices, and Helicobacter pylori infection among young adults. Objectives: to determine the prevalence of H. pylori infection in young adults and evaluate its association with dietary hygiene practices. Methods: this cross-sectional study from August 2024 to January 2025 included 127 participants aged between 80 to 40 years from outpatient clinics and student populations. H. pylori infection was diagnosed using a stool antigen test. Dietary patterns, spicy food and processed food, street food consumptions, and hand hygiene practices were assessed via questionnaire. Association were analyzed using appropriate statistical tests. P-value less than 0.05 was considered statistically significant. Results: out of 127 participants, 47.2% tested for H. pylori. The analysis revealed the following key findings. Spicy food consumption: 71% of infected individuals regularly consume spicy food, consumed to 48% of non-infected participants. Processed and fast food intake: 64% of infected individuals frequently consume processed or fast food versus 39% among non-infected individuals. Hand hygiene: poor hand hygiene was observed in 58% of infected individuals compared to 33% in non-infected individuals. Gastrointestinal symptoms: infected participants reported symptoms like acid reflux, bloating 1.8 times more frequently than non-infected individuals. Conclusion: H. pylori infection is highly prevalent among young adults and is significantly associated with unhealthy dietary habits and poor hygiene. Public health intervention promoting healthy eating and improved hygiene could help reduce the infection rates and prevent long-term complications. Jazakallah khair.
But your topic was very good and it's very important clinically, and we must assume that you should elaborate the results of your studies. So we are still waiting for the results. Because H. pylori, you see, ये तो मतलब मेरा बोलना कुछ अच्छा नहीं लगता क्योंकि इमरान साहब बैठे हुए हैं. He is the master of H. pylori because he is a professor of medicine. Lekin I know and that the H. pylori has a very clinical recurrence and it's very difficult to eradicate the H. pylori. तो आपने इतना अच्छा टॉपिक चूज़ किया था तो उसके रिजल्ट्स तो कलेक्ट कर लेती हैं आप. It's a wonderful topic, no doubt. It's a wonderful topic.
बिल्कुल सही कह रहे हैं प्रोफेसर अंसारी साहब. It's a very good topic and the selection is very good. And the area where you have done this job, it's a very crucial area because you are seeing a very larger population.
Yes.
लेकिन इन रिज़ल्ट को अगर थोड़ा सा सुपरवाइज़र के साथ मिलकर इसको बेहतर बना दें और एक टॉपिक आप इंसिडेंस देखना चाहते हैं या प्रीवेलेंस देखना चाहते हैं तो थोड़ा उसके ऊपर फोकस हो जाए तो दैट विल बी अ वेरी गुड स्टडी फॉर यू. थैंक यू.
Afza, I have a question. Yes. Actually, I want to ask how the confounders like socioeconomic status or healthcare facility have impacted your results. how the confounders factors like socioeconomic factor or healthcare facility has impacted your results. Confounder factors like socioeconomic status.
उर्दू में पूछ लो बेटा, उर्दू में पूछ लो, उर्दू में पूछ लो, माइक को थोड़ा सा आगे करके आप उर्दू में पूछ लें जो पूछना चाहते हैं।
Afza, I want to ask how confounding factors like socioeconomic status or the healthcare facility has impacted your results.
ये मोस्टली क्या कहते हैं पुअर जिनकी हैंड हाइजीन्स वगैरह होती हैं और क्या कहते हैं इन्हें हेल्थ अवेयरनेस नहीं होती है, वहाँ पे ये ज़्यादा कॉमन हो जाते हैं। ये है आपका सवाल?
No, it is, but I think जो हम कॉमनली जो सोचते हैं, जो कॉमनली जैसे होता है, तो इट शुडंट बी योर कंक्लूजन। आपका कंक्लूजन जो आपके रिजल्ट्स हैं उसके भी आप पे होना चाहिए।
I must comment one more important thing as far as the pharmacology is concerned. ये जो हमारी सेल्फ मेडिकेशन है, that self, कल एक टॉपिक पे किसी बच्ची ने या बच्चे ने बोला भी था, सेल्फ मेडिकेशन it creates that so many type of the medical problems. अब ये जो आप देखेंगे बाहर जितनी भी आपकी कैबिन्स और पान बीड़ी की मांजनीज बनी हुई हैं, उस पे इनो लटका होता है, इनो के साशे लटके होते हैं। दैट इनो इज़ नॉट द मशरूब, इनो इज़ रियली द ड्रग विद इट्स ओन एडवर्स इफेक्ट्स, सो इट कैन cause a multiple type of the adverse effect on the gastrointestinal tract. So this self-medication might be one of the reason behind the H. pylori.
Actually, I recently got a comment from reviewer on my manuscript कि जो भी conclusion है आपके जो study की, it should be the common क्या कहें उसकी जो understanding है, जो standard understanding है वो नहीं होनी चाहिए, लेकिन जो एक्चुअल आपका कंक्लूजन, आपकी रिजल्ट्स ने क्या कंक्लूड किया है वो होना चाहिए आपका कंक्लूजन।
अच्छा, जो मेरा कंक्लूजन है इसमें यह है कि प्रॉपर अवेयरनेस देनी चाहिए हेल्थ एजुकेशन डिपार्टमेंट्स वगैरह को, और जो हम स्पाइसी फूड एक्स्ट्रा कंजर्व कर रहे हैं वो कम करें, कि हम अपनी हाइजीन को मेंटेन करें, स्पाइसी फूड का कंजप्शंस है वो हम कम से कम करें, तो हम इस तरह से इसको मज़ीद बेहतर कर सकते हैं।
थैंक यू।
ठीक है बेटा, ठीक है, थैंक यू। इसमें एक कमेंट मैं शॉर्टर देना चाहता हूँ कि देखिए डिस्पेप्सिया एंड एच पायलोरी इन्फेक्शन, दीज आर इंटायरली डिफरेंट थिंग्स। तो बाकी जितने भी आपने फैक्टर्स बताए ये डिस्पेप्सिया के हैं, और इनको एच पायलोरी के साथ कोरिलेट करना सिर्फ कि ये इसकी वजह से, ये थोड़ा सा एक मिसकॉन्सेप्ट है। थैंक यू।
Excuse me, I have a question.
I think we should move to the another presentation.
Moving on, next presentation is by Unsa Salim. Her title is Impact on Cognition and Creative Capacity Among AI Users, a Cross-Sectional Study.
Assalamu alaikum and a very good morning everyone. Here is Unsa Salim, a third year MBBS student from Lumhs, Jamshoro. I am extremely thankful to MURC 25 for giving me this opportunity. I am thankful to my supervisor, Associate Professor Dr. Muslim Ali Lakher, and my co-author Misbah Mehman for their efforts to complete the research project. The title, Impact on Cognition and Creative Capacity Among the AI Users in Pakistan, a Cross-Sectional Study. As you all know, that the integration of AI has been done in almost all the aspects of the field. One of the survey quotes that 86% of the population is using AI for their academic purposes. We have done this research to know the impact of AI on education, whether it is increasing the productivity and quality, or if it is restricting the cognition and converging the creativity rather than the divergence. Let's see what other researchers have done so far regarding this agenda. The Cornell University has done a research on large language model known as LLM. The result of this study says those who uses these tools have lowest performance at linguistic and lowest cognition in essay writing. And surprisingly, these students even don't remember what they have written in their essays. The second research is a longitudinal analysis conducted by the MIT Media Lab, which revealed that the prolonged use of the AI may hinder deep learning. The third research is the Gen AI research, which says that students who uses ChatGPT scored on average 6.7 points lower in exams than the non-users. And the point here to be noted is that these students were among the high-performing students. So now let's see how we have conducted the research. This study was a cross-sectional study, and the data was collected via simple random probability sampling via an online Google form questionnaire, which was distributed to different students and different professionals across various academic disciplines of Pakistan. The sample size was based on the fact that 86% of the population is using AI. So using the Cochrane formula, it came out 185. We got a total of 193 responses, but after final screening, 185 were finalized. For data analysis, SPSS tool was used. The inclusion criteria include those who are aged under 18 and 45 years. The participant must be actively using AI, and the participant must be actively using AI for the academic purposes. And the exclusion criteria include those who are not in this age limit, those who are not using AI for educational purposes, and those who are diagnosed with some neurological disorder which is unrelated to the AI. We also got our ethical approval from ERC Lumhs Jamshoro, and every participant were required to give informed consent digitally before assessing the questionnaire. So now let's move to the results section. As this bar chart is showing that the majority of the population was between 18 to 24 years age, this pie chart is showing that the female constituted a major proportion of the study. In terms of the education, more than 50% held a bachelor's degree, in which 63% was from medical and health sciences, followed by engineering and technology. 64% of the population is using AI frequently, which means that the 64% of the participants are using AI more than one time a day. And 50% admitted that they are relying on AI actually. When we ask about 50% believe that when they need information, they promptly search on the AI rather than recalling it from the memory, and 50% believe that they are relying on AI actually. When we ask about the impact of AI on creativity, here we got the equal responses. 50% believe that AI can significantly reduce creativity, and 50% believe that AI can significantly enhance creativity. But in other question, more than 90% believe that the prolonged use of the AI may have a negative impact over human intelligence. We also ask whether AI leads to convergence. On this statement, less than 50% agreed, and 36% are still in the doubt. We also ask how much they are confident in decision making without AI. Here the participants showed a positive stance towards AI. So this whole result shows a complex yet critical relation between AI and its users. So let's move to the discussion session. As I said that there is a complex and nuanced relation between AI tools and their users. The high adoption rate of ChatGPT shows that AI is the habitual and routine part of Pakistani student. We made a chi-square analysis between AI usage frequency and decision making without AI assistant. The p-value was less than 0.05, showing that there is a significant relation between the both. This finding is consistent with the MIT research that the prolonged use of the AI may lead to the convergence rather than the divergence. We also made another chi-square between the duration of AI and its impact on the creativity, but this was an insignificant relation, showing that the impact of AI on creativity is not dependent on the duration, but it might be dependent on some other qualitative aspects such as the type of the task. So the limitation of this study is that it mainly involved the medical student. It was a self-reported data. So the future direction is to involve the large samples across a diverse field of the Pakistan, and to reduce the potential biasness, longitudinal analysis and experimental design might be needed. Here are the references that were used in the study. Thank you very much. Questions?
Question from
Does
the audience?
anyone have any questions, please?
Beta, I just want to ask, what do you think, which AI tool is better for the cognitive improvement in the student?
Sir, I believe that no AI tool, I can say an exact statement that no AI tool is significantly good for a human intelligence, because this study is showing that AI are the tools that are decreasing the innovation. So if everybody is using the AI, then where would be the innovation? It would lead to the convergence. Rather than we want the divergence. Innovation thinking, I think it would be decreased. No matter, AI should be used, but in a balanced, amount. And this study is also to support the policy makers to have keep an eye over the young minds who are writing the essays, who are writing everything that requires creativity from the AI.
Do you agree we should include the AI in the curriculum, and just to put some of the weightage of the AI user in the curriculum?
Sir, like every drug comes with a side effect, I believe that every tool comes with its side effects. So I don't think so any AI tool could have a positive, 100% positive effect, like 100% efficacy. So might be there are researches going on, like the research is recently going on the neuronal cells. They are working on the neurons to work like a ChatGPT. And one of the study, due to the time limitation, I also didn't mention here, there was a research that is related to the biomedical that shows that the 50% of the researchers are now having the AI research. So this shows that it would decrease the innovation.
Thank you.
You're welcome.
I just also highlight one of the project done by the Biomedical Institute of the Lumhs. They already invented a camera which can easily detect the pneumonia without any X-ray. So big clap for the Biomedical Institute.
Yes, any question or any comment?
I have a question.
Yes, please. Yes, please.
I have a question. Can we make AI confused? Can we make AI confused?
Can you repeat your question?
Means we are able to make AI confused. Can you make AI confused?
Anyone can make AI confused.
How?
You can ask multiple times, and
according to you, no research is half in between. Research is not like a sandwich or omelette. So according to your research, you are in between. So can you make AI confused? Can we make AI confused?
As far as my research is concerned, my research is related to the impact on cognition and creative capacity. The result says that it has potential drawbacks, but it also has the positive enhancements. There are no research can say a one-line statement.
You guys are just clapping. My answer is in between. I don't think.
I quoted an example of the chase previously, that you can confuse the machine by your mind. It's not impossible. So you can confuse the machine by your mind. So all the things are possible for the human.
Okay, yes, actually, what I conclude from her study, that no one tool is exactly the 100% beneficial. It has their own drawbacks, but I'm really with her word which she used, that is the habitual. The students are habitual. That is a very alarming situation. If we are becoming habitual to such sort of tools, then definitely in the coming years it creates a very much problem. But if you use such sort of tools for, you see, for some benefit, then yes, you can get the benefit. I could respond to a question from the audience that can we make AI confused? जी बेटा आप confuse कर सकती हैं, आप चैट GPT में अपना नाम लिखें और उससे पूछें कि ये क्या करती हैं, तो वो बताएंगे कि ये जो है वो किसी ज़माने में USA की प्रेसिडेंट थी. अभी आप करके देखें.
Okay.
So well, it's a very good presentation.
Thank you, sir.
Very good.
One question last. Okay, छोड़े. रहने दे. बस एक क्वेश्चन था मेरा बेटा आपसे, बिकॉज आप अच्छा एक तो घबराइएगा नहीं, मेरा क्वेश्चन आपकी रिसर्च से रिलेटेड है कि आपने कहा था कि इसमें अक्रॉस द पाकिस्तान, तो कैन यू एक्सप्लेन कि वो जो अक्रॉस द पाकिस्तान मतलब डिफरेंट सिटीज़ के सैम्पल्स थे, वो स्लाइड हमें कहीं नज़र नहीं आई.
Camera, mic on. Sir, we have collected the data across the Pakistan, surely. Majority we have, because 64% is from the medical, so the universities that were included in it was the Dow, LUMS, PUMS, ISRA, and these were 4 universities. And in educational, NAST Islamabad, FAST Karachi, these 2 were from the engineering. And for the business studies, IBA was there, and NED was also there. So these were among the universities that we collected data. Thank you, sir.
Thank you. The next presenter is Maliha Jabeen. Her paper is titled Relationship Between Decision-Making Styles and Levels of Emotional Intelligence Among Undergraduate Students of Ibn Sina University.
Assalamu alaikum everyone. I am Maliha Jabeen and I am a final year MBBS student from the Ibn Sina University. As you can see, my study focus on relationship between decision-making styles and levels of emotional intelligence among medical and dental undergraduates at Ibn Sina University. Previously, there are many studies investigated the association between these 2 domains, but these studies are very limited, or we can say that specifically address the medical and dental students. So recognizing this gap, my study's aim is to find association in this specific group. Decision making is a critical skill, and it is very important because it influences both personal and professional success in our educational healthcare educations. And many times students, medical students especially, just face the complex situation that needs the sound judgment under pressure. So it is very important that they have a good ability of making decisions, which is and emotional intelligence, on the other hand, which is the ability to recognize, understand, and manage one's emotion as well as others, plays a very important role for us to approach and how we approach and resolve these situations. Our study is descriptive cross-sectional, and our sample size is 180, which is equally divided in males and females, and we have our convenient sampling. Before I start result, I want to just summarize that my result have 2 components. In one part, I am describing the association between the sub-scales of decision making and emotional intelligence, and on the other hand, in second part, I am describing the overall association and impact of emotional intelligence on decision making. So as you can see that age-wise, I used socio-demographic characteristics, which is age, gender, and residence. So you can see in my slides. So age-wise, both age groups having the relationship management domain and a systematic style of decision-making. As you can see, male who are self-aware are more systematic, and females who are good in relationship management tend to adopt dependent style. According to the residence, the students who belong to urban areas are good in relationship management as compared to rurals and having a systematic style, while the rurals having the spontaneous style. And on the basis of temporary residence, the day scholars having the good relationship management and a dependent style. So as you can see that I have described these sub-scales, and there is not a very particular specific association pattern among them. So let's see what is the overall impact. This is the overall result, which is showing that systematic style and relationship managements are the most prevalent. This is the overall result. Age-wise, you can see that the age group which is less than 20 years is more good in emotional stability or having a higher emotional intelligence, and on the same side they are good in decision making. And as we can see that females who are good in emotional intelligence as compared to males also having a good decision making. Day scholars having the good means higher emotional intelligence, and on the same side they are good in decision making skills. Similarly, the urban people, students who are from the urban areas having the higher relationship, higher emotional intelligence as compared to rurals, and are good in decision making skills. So in the second part, you all have seen that those who are in good, higher emotional intelligence, good in emotional stability, also having the good capability of decision making. So it is showing a very positive impact, and it is showing a very close relationship of decision making and emotional intelligence. So our findings suggest that fostering emotional intelligence, particularly relationship management, may enhance the decision making capability of all the future healthcare professionals. Thank you very much.
Thank you, beta. Thank you.
Thank you so much. The next presentation is by Rabel Sheikh. The title is Clinical Spectrum of Headache Among the University Students.
Start with the glorious name of Almighty Allah, who is the most kind and most merciful. Honorable judges, worthy teachers, and my dear participants, Assalamu alaikum. I am Rabel Sheikh, a third-year MBBS student, along with my co-author, representing here ISRA University, Hyderabad. So my research topic is clinical spectrum of headache among the university students. Now, moving towards the background of our study, as you know that the headache is the most common problem among the university students, as well as it affects the young adults. The age may influence on the severity, onset, and triggers. The importance of our study, the targeted prevention strategies in young specific age group. Now, the objective we have covered on the basis of our background to analyze the headache pattern among the university students, which is young age group. The age varies from 18 to 22 years. Now, identify the age-specific triggers and impact on academic and social life. Now, the methodology of our study design is a cross-sectional study, and we have collected just 88 students from ISRA University, Hyderabad. Now, the variables of our study, the headache intensity, severity, onset of age. Now, the inclusion criteria, those who are willing to participate, and those students who had headache at least from previous 6 months, and also those students who had feel headache 1 to 14 days in a month. Now, the exclusion criteria, those students who have pre-hypertensive, any severe disease, any brain trauma, or any eye problem, any thyroid problem, or any recent trauma or recent incident at their home. Now in the analysis we have covered the age stratified comparison. We have covered three objectives. One of the headache intensity, other is a caffeine overuse, and the last one is a sleep deprivation. Now, the caffeine overuse is defined as if a person is taking more than 3 cups of caffeine throughout the 24 hours or throughout the day, which may contain more than 400 grams of caffeine. Now, the sleep deprivation is defined as if a person is sleeping less than 5 hours throughout the 24 hours. For example, if a person is sleeping 3 hours at night, 2 hours at a day, so he does not come into that criteria if a person is sleeping less than 5 hours in a day. And in the last, the headache intensity we have calculated through the Likert scale, which may include the 5 different stages or groups, the grading from 0 to 4. In the grade 0, we have those who had 0 headache. In the grade 1, those who had mild headache. In the grade 2, they have average headache. And the grade 3, those who had severe headache. And the last grade 4, those who had extreme headache. Now, moving towards the results, we have divided our results into 2 different portions. First of all, the prevalence and onset. In the second part, we have defined as age-specific triggers. In the prevalence and onset, the peak prevalence we have found in our results is the age 21 year is the most risk group, which may include the 38% student, which include the 33 students out of 88 students of collected data. We have divided further into the 2 portions. Those students who had feel their first time headache before the age of 15 years, and those students who had feel their first headache before the age of 10 years. Now the results are, there are 55% students are those who had feel their first time headache before the age of 15 years, whereas only 14% students who had feel their first headache before the age of 10 years. Now this is the graphical as well as tabular representation of our first part of results. Now moving towards the second part of our results, which is age-specific triggers. Now the age from 18 to 22 years, they have 70% headache due to their study burden, while there is only 20% headache due to their sleep deprivation. And the age 21 to 22 years, they have headache 62% due to the stress, while there is only 20% students, they have headache due to their caffeine overuse. This is the graphical and tabular representation of second part of our results. Moving towards the discussion we have made after our results, the age 21 year is a high risk group due to their examination as well as thesis work, and the younger student lifestyle factor like poor sleep. The finding aligned with the global headache technique, but it emphasized the academic pressure is the key driver. Now moving towards the conclusion, the headache profiles vary significantly by age. The need for age-targeted intervention in university on the basis of intervention in the university or recommendation to the university to stress management workshop, and also counsel the student those objectives such as the sleep deprivation to reduce their caffeine overuse, and also the university should have counseled the student for the handling the academic pressure, as they can maintain their mental as well as physical health. If they can maintain their physical as well as mental health, they does not only perform in the academic session, but also they'll perform in normal routine of life. Now, limitations in future direction. Our study is a single center and a small sample size of just 88 students, the data we have collected, but it opens the door for the multi-center and the longitudinal study, which may vary change in results and also help the university in the intervention. In the last, I'll thankful to my co-authors, my mentor, and the organizing committee MURC 2025, and who provide me opportunity to present here, and I'm happy to answer your all questions.
Thank you so much.
Thank you, Rabil. And that concludes the presentations for today. Now, I would like to ask esteemed session chairs to share some of their concluding remarks and feedback on all the papers that were presented.
Thank you so much. That was a wonderful session, and really speaking honestly, it's beyond of the expectation that the student presented well, and their topics are entirely very innovative. What I actually felt over here, that at our era when we did our MBBS, nobody was there to support us in all these directions. And now, with the help of the worthy Vice Chancellor, Professor Ikram Sahab, and the Director Academics, Professor Manzoor, they have done a great job for the student. So all the presentations were very good. Few of the students were exceptional in their presentation, in their style of the presentation, their slides, their studies, their topic, and the concluding all the their presentation. So I think so this practice should be continued, and we will see all these researchers, new young researchers in the future, that they will produce the very good rank for the LUMS, and all these studies, if they will produce the good papers, they will increase the citation of the LUMS. You understand that yesterday we have seen one of the presentation of Professor Vase, that the AKU student, they are doing the 100% of their research, and all the other institute, they are doing about 30 to 40% of the research. So I actually advise and request to all the students that join to the faculty as the young researcher to increase the impact and the ranking of the LUMS. Thank you so much, Pakistan.
It's really, I must congratulate all the participants of this conference of undergraduate students who have presented over here and who are present over there. They are really remarkable event for the university, and I must congratulate our worthy Vice Chancellor and his team, that is Director of Academics and entire faculty and the team. This is not the end. This is just a start, and definitely we have to improve and improve and improve, and there's always in the room for the improving. Really, आज मुझे बहुत मज़ा आया. Really, I enjoyed by listening the very intellectual type of the presentations. अभी जिस बच्चे ने वो present किया था headache पे, तो एक आप में से अगर कोई बच्चा है, तो next time आप data ले लो, एक आप study कर लो कि बच्चों का impact faculty के सर दर्द पे और faculty का impact बच्चों के सर दर्द पे, तो पता लगेगा कि faculty over stressed है या बच्चे over stressed हैं. So anyways, I must congratulate all of you. Well done, better.
Now I would like to request our session judges, session chairs to please come forward. Along with, I invite Professor Dr. Ashok Kumar, Dean Faculty Surgery and Allied Sciences, Professor Dr. Manzoor Ali Lakher, Conference Chairman, and Professor Dr. Ranumal Piryani to please come on stage to award certificates and shields to the students and chairs. Calling on stage, Ms. Aisha Hina. Isra Imdad. Ghania Khan. Lajina Sahar. Aliza Andli. Ikra Pamar. Muhammad Hanzala Yusfani. Hafsa Abdul Wahid. Muhammad Bachal. Maliha Jabeen. Ikash Jayraj. Immer John. Unsa Salim. And lastly, Rabel Sheikh. I would like to request Professor Ashok Kumar to present a shield to Professor Dr. Mohammad Ilyas Siddiqui. Sirs, please present the next shield to Professor Dr. Munawwar Alam Ansari. I request Professor Ranumal to please present the next shield to Professor Dr. Imran Sheikh. And the last shield for myself as the moderator. Thank you, chairs, for your valuable time and guidance. We conclude the free paper session 6. Ladies and gentlemen, we will now be taking a short break of 30 minutes, a high tea break. That will be followed by keynote session 2, as well as the most awaited part of the conference, the Reels competition. So we expect you to be back in the hall within half hour, so we can move on and resume the proceedings. Thank you.